All right, it's 9:50 on this Wednesday morning. Many women today suffer from an overactive bladder. We're talking urinary incontinence. It's a topic that can be uncomfortable and embarrassing for ladies to admit, or worse yet, even talk to a professional about this. But it is important to have that conversation, and your gynecologist should be able to help you out with some of the answers. So here to talk more about it, what causes it and what can be done, is Dr. Kenneth Finkelstein with Women's Healthcare of Illinois. And of course, he hangs out a lot at Christ Hospital there in Oak Lawn. Thanks for joining us.
Thanks, Darlene, for having me back.
So, Doctor, Special K, let's talk about this. What causes it and what can be done? We talk about it with women who sneeze, who cough, or sometimes when you're working out, there's a leak down there. What causes that?
Well, I think that when you're looking at incontinence by definition is basically involuntary loss of urine, which is never normal. So I get a lot of patients come to me and say, well, you know, I've gotten older and it happens. Well, guess what? It's never normal to leak urine. So that's the first thing. The second part of it is there's actually two different types of incontinence. One is called urge incontinence, which means you lose urine with intention. You try to get to the bathroom, can't get there quick enough.
Right, so we always talk about how that seems to happen when you get to the front door, the key in the door.
Exactly.
That's the urge.
Right, that's urge incontinence. And then the one you described earlier is it's stress incontinence. So stress incontinence means that you lose urine if you cough, laugh, sneeze, lift, exercise. A lot of my patients, you know, you go to the gym, you work out, even though you empty your bladder beforehand, you still leak. And all of these are very, very fixable.
And I was just going to ask you, we were going to talk about this because this is something, we've talked about this before on the show here on Good Day. You performed my hysterectomy and you also took care of that condition for me, because 1 in 3 women deal with that, and it's not something that you should be ashamed of or nothing you should be embarrassed about, especially talking to your doctor about.
Right, absolutely. So for example, in your case, we did something called a urethral sling. So I know there's a lot of controversy on TV when you see the advertisements with lawyers saying, oh, call us if you've had mesh put in your body.
Right.
I mean, I think it's a lot to talk about for this segment, but believe me, urethral slings are completely safe, FDA approved, no black box warnings, and they're simple surgeries. So done by themselves, these are 12-minute outpatient procedures with a very small incision just under where your urethra is.
And are you finding more women that have had multiple births, women that are menopausal that are dealing with this urine incontinence? And let's also talk about fecal incontinence while we have you here.
Well, thank you for bringing that up. So number one, yes, the more kids you have definitely can cause these issues, and like I said, they're all fixable. But fecal incontinence is something that's kind of you know, no one talks about. Very fixable, a lot of things that we can do. Also happens because of childbirth, and you know, if you come to a urogynecologist, these are the kind of things we actually can address and fix.
And you say with fecal, there are also 2 different fecal incontinence, when you have gas or when there's a bowel movement.
Correct. So you can have incontinence where you just lose gas continuously. All this usually comes from childbirth and injury during childbirth, or actually lose feces, but again, very fixable.
And talk to your doctor about this.
Oh, absolutely. And if your particular doctor doesn't treat it, get to a urogynecologist that can definitely fix these problems.
All right, what's your web address for people out there just looking for more information as well?
Sure. So it's whcillinois.com, and just get online, give us a call, and we'd be more than happy to help.
All right, Dr. Finkelstein, thank you so much for having this open conversation with us. Now everybody in Chicago knows a little bit more about me than they probably want to. It's 9:54. We'll be right back on the other side.